Hello, I'm Dr. Ashmina Khalsa. I'm the Senior Consultant Obstetrician Gynecologist at Cloudnine Hospital, Lucknow Division. Breastfeeding can have certain pathologies associated with it, not because of breastfeeding, but maybe because we as new moms have been a little careless. One of these conditions happens to be mastitis. Mastitis is nothing but inflammation of the breast tissue, which is most commonly caused because of inadequate emptying of the breasts. This inadequate emptying can be because the mother has been probably in prolonged surgery, she's exhausted, or she's been on certain medication where she's not allowed to feed her baby, she's sick because of certain medical conditions, she's not allowed to feed her baby, baby's premature, baby's in the NICU, baby is not able to feed, or just there is improper latching, which is the most common cause of a mastitis. In this condition, a mother needs to be aware that her breasts will become red, hot, the skin outside the breast will be warm to touch, she'll experience pain, and a lot of mothers in mastitis may even have fever. Fever is a warning sign in this, as mastitis, if not caught or diagnosed early, can turn into a breast abscess, which may later require a surgical intervention for the abscess pus to be drained out. There are a number of ways where we can prevent this condition. However, the most important is that we learn how to attach our baby to our breast. We practice all different kinds of methods of breast latching of the baby and decide which one is the best for us. For this, we have our expert team of lactation counselors who will be helping you, guiding you throughout your journey of lactation. Now, the next way of preventing is that every time you feed your child, you make sure that the child has fed properly from both the breasts. It's not nice to just have a partially fed baby and then a lot of mums like to do is mix feed the baby, give a top feed. What happens in that is half your breast is full, half empty. You don't realize it, and over the time, over a few days, it turns into an inflammation, into an infection. The third way we can prevent is a regular breast massage, which we recommend to a lot of you after delivery. A breast massage will help in a proper blood flow towards the ductules of the breast. It will help also to keep the pores of the nipple through which the milk is actually jutting out open, because if the outlet is closed, there's a back supply, clogging of milk into the milk ductules, again leading to the condition of mastitis. A lady who's actually having such kind of a pain must consult her obstetrician immediately, who will help her in taking analgesics, who will help her advise with certain medications, certain lotions to prevent this. If there's a cracked nipple, especially where you have been attaching your baby improperly to the breast, it is good that you again consult your obstetrician or your lactation counselor, have this checked, because a cracked nipple also becomes a source of infection and becomes a source of mastitis. So we must always be very careful, attentive when breastfeeding. If you feel there's any lag, any difference from the routine way of breastfeeding, always good to come back to us and take our advice. Thank you.